And so we're going to say welcome to our webinar today. As you may be aware, the College of Dietitians of Ontario Council recently approved a policy on determining currency practice hours for dietitians in Ontario in June of 2022. We're going to share some links in our chat to the policy, both in English and in French, as well as our revised definition of practicing dietetics. So thank you for sharing those links. We'll also be discussing, so we have the policy. We also will be discussing the revised definition of practicing dietetics, which was updated following the policy's approval. And I thank you for sharing all of those links in the chat, Dan. On our next slide here, we thought first it would be helpful to define what we mean by currency. So a currency requirement refers to dietetic practice hours experience within a specific period. Now, this may sound like a new term. It's not, don't worry. It's not a new concept. Currency really means a member's knowledge, skills, and related work experience are up to date. So as you know, every year at renewal, we declare our practice hours over the previous 3-year period, and maintaining at least 500 hours of dietetic practice over 3 years ensures that dietitians can practice dietetics safely, ethically, and competently. In fact, 500 hours is a legal requirement. So at renewal, we all annually declare if we practice dietetics for 500 hours or less in that previous 3-year period. And the policy and revised definition will help dietitians when completing their annual renewal declaration regarding dietetic currency practice hour requirements, especially considering the pandemic now. So we'll move on to our next slide, and let's just take a look at the session overview today. So we hope you'll leave the session with a bit more knowledge and understanding of, one, what counts as a practice hour, the new policy itself, the changes to the definition of practicing dietetics, which could assist you when determining your practice hours, of course. We always like to give practice examples. A lot of you always tell us that practical examples are helpful. We'll talk about what happens if you do fall below the currency hours. We always have a little section at the end that we reserve for question and answer period. And what I'll do next is I'll pass it over to Carol, who will walk us through the quality assurance side of things.
Wonderful. Thank you so much, Samantha. So next slide, please. Wonderful. So by way of background, we know that the college regulates dietitians for public protection. And we do this in a way that promotes currency, competence, and safe dietetic practice. So this new policy that Samantha mentioned on determining currency hours is related to right touch and risk-based regulation. When we think about right touch ensures that the level of regulation is proportionate to the level of risk to the public. And risk-based focuses on proactively identifying actual and potential risk of harm to the public. We need to implement regulatory efforts to mitigate and prevent any harm from occurring in the first place. And to assure the public and our system partners that dietitians practice safely, competently, and ethically, the college approved this policy to help dietitians. So next slide, please. So of importance is the legislation supporting currency practice hours. On the slide, you can see the first one, the RHPA, the Regulated Health Professions Act, which is considered the umbrella legislation that the colleges and the QA program are required. Each college is required to have a QA program. Under the RHPA, we have our profession-specific act, which is the Dietetics Act. And this act really deals with things like scope of practice and use of the dietitian's title, so the protected title. And while the college requirements for 500 hours falls under the college's registration regulation, the QA program is responsible for assessing dietitians who have not practiced at least 500 hours in the last 3 years. And we can share the link to the registration regulation. Next slide, please. So the QA program aims to foster and support all dietitians' continuing competence and quality improvement through education and assessment. Dietitians can feel confident that the quality assurance program is not punitive. Members who declare fewer than 500 hours in the past 3 years are, as I mentioned, referred to the Quality Assurance Committee to determine their competence. Again, we have more policies under our QA program. So we have our practicing fewer than 500 hours, as well as other quality assurance policies that you're welcome to look at. And they're available both in English and French. So, but the policy that we're going to focus on today is the one on practicing dietetics with the definition, which is intended to help dietitians use the categories and their judgment when declaring their currency hours. So what I'll do now is hand over to Diane to talk a little bit more about scope of practice.
Thanks, Carol. So we need to discuss the dietetic scope of practice, and this is our scope of practice statement, which is in our profession-specific legislation, the Dietetics Act. And so the scope of practice being defined as the assessment of nutrition and nutritional conditions and the treatment and prevention of nutrition-related disorders by nutritional means. And so this refers to the area of expertise that we hold as a profession, dietitians as a profession, what we're trained to do through our educational programs, and to a lesser extent, the evolution of the profession as its role develops. And then secondly, it's also the activities that we're legally permitted to do under our legislation, under the Dietetics Act and under the Regulated Health Professions Act. And of course, we cannot forget our own individual area of competence, our own knowledge, skill, and judgment. On to the next slide. And when it comes to competence, knowledge, skill, and judgment, we cannot forget the integrated competencies for dietetic education and practice. And I think Samantha will share the links in the chat. So all of these resources help us when we're considering our practice hours. We're going to pause right now. We're going to go on to our next slide and a first poll question of the day. Now that we've had a little bit of background on the quality assurance program and all our relevant resources, let's do a poll question together. So I'm going to launch the poll and you'll see it appear on your screen. And so the question is anonymous. If you're participating today, all our polls are set up so you're answering anonymously. And the first question is, all general members of the college annually declare whether they have practiced dietetics for 500 hours or more. Is it A, in the previous year, B, the previous 3 years, or C, the previous 5 years? So we'll see. Thank you for participating. Take some time to see the responses. I'm going to end the poll and share the results. So you should be able to see the results on your screen right now. So if you answered B, you're correct. This is underpinned by the role of the college to protect the public by regulating the profession in a way that promotes currency, competence, and safe practice. And so the currency hour requirement, like we've talked about, exists to ensure that we all remain current and competent in our practice. And sometimes there's confusion that the 500 hours is over a 1-year requirement, but it's 3 years. So this year at renewal, we're declaring our 500 hours over the last 3 years from November 1st, 2019 to October 31st, 2022. And if someone's a new member or new to the quality assurance program, of course, we welcome you. You wouldn't be declaring your 500 hours until 3 years from now. And if anyone would like to read more, we'll share a few resources in the chat or as a refresher, some questions about the quality assurance program. So I will stop this poll and we'll go on to the next slide. So earlier we mentioned we talked about the definition of practicing. The college's definition of practicing is developed to assist members in determining their practice hours and was designed to elaborate on the scope of practice statement in the legislation. As we know, the definition of practicing is quite broad and includes various areas of practice and workplace settings, and the description provides examples of activities for guidance, but it's not exhaustive. So on the slide here, more specifically, we do have the definition, which includes both paid and unpaid activities for which members use their food and nutrition specific knowledge, skill, and judgment, while engaging in the assessment of nutrition related to health status and conditions for individuals and populations, the management and delivery of nutrition therapy to treat disease, the management of food systems, the management, education, or leadership that contributes to enhancement and quality of health, of dietetic and health services. And of course, you can refer to the definition at any time. What we find helpful when we get questions, so members sometimes call to say, am I practicing? We don't say yes or no as practice advisors or in the professional practice program, but we guide and help members problem solve. So sometimes flipping these statements into questions, for example, am I assessing nutrition related to health status and conditions for individuals and populations, or am I managing and delivering nutrition therapy to treat disease? So asking ourselves these questions, so turning those statements into questions can be helpful. And you might be wondering, so what really has changed with the definition? Really minor. As you know, this went out for consultation, and Carol's going to speak to the process in a bit. But if we take a look, some of the language that has changed, talking about practicing, whether it's paid or an unpaid capacity, because we used to get inquiries from members asking, if I'm volunteering, does it count? Am I practicing? And if you're practicing according to the definition, yes, it would count whether you're being paid or not. Talking about inclusivity in terms of groups, to also in terms of assessing groups related to health status, teaching nutrition, dietetics, or other professions in schools. Also due to some ambiguity, like if someone was working for a professional association or working for a regulator, does that count? Like if I'm on council, am I practicing, for example? So whether someone is developing regulations, programs, or policies. So those were also revised on the definition. So you can take a look at the link and review that. The policy is also linked on that page for you as well, and an article, what counts as a practice hour. So all these resources can help guide you if you're not sure if what you're doing contributes to those 500 hours over the 3 years. We're going to go to another poll question next on the next slide. So I will launch our next poll, and you should see it up here on the screen. And this just a question as I just spoke about. So again, you're participating. Thank you. You're answering anonymously. Does paid or unpaid or volunteer work count towards dietetic practice currency hours? A, no, only paid dietetics work related counts, or B, both paid and unpaid dietetics related work counts. And I will thank you for participating. I will end the poll and share the results. Amazing. Got that right. If you're practicing, it doesn't matter again, whether it's paid or unpaid, it counts towards your practice hours. And again, just to clarify that we're not commenting on whether work should be compensated or not. I think it goes without saying, everyone should be compensated fairly. This is just, again, to identify and respond to queries that we received. If I'm volunteering and I'm practicing, can I count those hours? And the answer is yes, you can. Although, of course, paid employment could contribute to currency, it's not the sole condition for developing currency. That comes back down to developing your knowledge, skill, and judgment while you're practicing. All right, I'm going to pass it over to Carol now. Thanks, Carol.
Thank you. So I'm just going to spend a few minutes talking about why we needed to have this policy and the process through which we developed the policy. So as you heard, the key reason for why is to keep pace with the change in healthcare environments. And we've been through a lot of change in the last few years, as well as to meet public expectations. So we've been hearing from dietitians who've been redeployed and concerned about meeting their currency hours, some expressing that they might be redeployed for up to 2 years or more. We heard from dietitians who are doing more work aligned to the ICDEPs, as Diane had mentioned, as well as college members doing work for professional bodies and council and college. Where do they fit in terms of practicing dietetics? So overall, we were hearing that our members needed more guidance and more support. So we completed the analysis to confirm this policy, and the analysis included environmental scans with Ontario Health Regulatory Colleges, as well as our dietetic Canadian regulatory colleges. We consulted through survey with dietitians, as Diane had mentioned, including our system partners and health regulatory colleges more broadly. We also sought legal counsel on the final documentation before we took it to council. And of course, we want to thank you if you contributed or responded to the consultation to make this relevant to our members. We heard that the policy would make it easier for dietitians to continue to be redeployed in the current environment and thus likely to reduce any economic burdens. And we hope that the policy will assist members directly in determining if they are practicing and if their hours count towards the 500-hour requirement. So can we have the next slide, please? So what I'd like to do now is really highlight the three main categories in the policy that you need to consider when you apply your professional judgment. So in the policy itself, it starts with a preamble. We have a purpose statement. We have some definitions in the footnotes and some references. All of this is important. However, as I mentioned, the three categories we're going to focus on them are: one, can you just advance the slide, please? The first one would be, actually on the slide has the three overarching categories. So I'm just going to introduce them and then we'll talk about each one. So the three categories are based on the following questions. So if what you're doing is related to the definition of practice in dietetics, so the revised definition as Diane just introduced. Then the second category is if what you're doing is related to a delegated act as per our delegation standard. Or the third is if what you're doing has transferability to dietetic practice based on the competencies. Next slide, please. So let's look at the first category. The first category we're looking at, does the activity fall within the updated definition of practice in dietetics? Dietitians are expected to exercise reasonable professional judgment to determine if their practice hours are based on this definition of practice in dietetics. And so this is sort of easy because if you are practicing dietetics, you know that you can count this as your currency hours. Also to mention, if you're practicing dietetics, you need to consider whether you're holding liability insurance, which is a requirement, and what one can do. So one of the exceptions to using this policy is to determine whether someone is practicing if they're suspended. And this is more for people who go through any limitations on their practice. Next slide, please. So category 2, it's about if the task or activity falls within the performance of a delegated controlled act. So we have detailed guidance and performance expectations outlined in standard for dietitians while practicing through a delegation of a controlled act. And so if you are doing this, it's important to also go through that standard to ensure that you're following all of the practice expectations there. It is essential to consider other dietetic competencies as the foundation for performing a controlled act when practicing the act as a dietitian. For example, dietitians cannot prescribe or communicate a diagnosis unless it's delegated to you. And if you're adjusting insulin or communicating a diagnosis of diabetes, you can count this towards your practice hours if you have the appropriate delegation to do so. Next slide, please. And the third category speaks to whether the activity or task is considered outside of your dietetic scope of practice, and if so, whether it has transferability to dietetic practice, and whether it reflects the skills and knowledge of the ICDEPs, which is the Integrated Competencies for Dietetic Education and Practice, as Diane introduced. And does it require you to be an active regulated healthcare professional? For example, doing contact tracing for COVID as a regulated healthcare professional. So to make this a little more interactive, we're going to try a poll question. So I'm going to hand over to Diane.
All right, thanks, Carol. So we have a poll question. I will launch the third poll. All right, so which of these would count towards practice currency hours? A, COVID-19 contact tracing as part of redeployment in public health. B, volunteer speaking engagement on child nutrition to teachers at a school. C, management of food services in a long-term care home. Or D, all of the above. Give you a few moments to answer. Again, the poll is anonymous. Right, I will end the poll and I will share the results. So if you answered D, you're correct. All of the above, those count as practice currency hours. If we apply the 3 categories, we can see that A would fall under the 3rd category. It may be outside of our scope of practice, but transferable to practice as it reflects knowledge and skill that's outlined in the ICDEP, communication, collaboration. So again, those temporary redeployment activities that we've heard during the pandemic, many dietitians in Ontario being redeployed, are authorized to engage outside of their scope of practice to respond to, prevent, or alleviate the effects of COVID-19. And we thank you for your service. Thank you for caring for Ontarians during this time. Some examples that we are aware of during the pandemic included, like Carol mentioned, contact tracing, contact management work, COVID testing or screening, follow-ups in terms of things like health histories, investigating symptoms, or providing education and teaching to clients for self-monitoring. For B, if we think of the first category, the definition of practicing, although this is unpaid, it still counts, providing nutrition education to teachers, applying one's food and nutrition knowledge, using the dietitian title in this example. C, managing food services. We can see the first category would apply the definition of practicing, the management of food service systems. And so again, just a reminder to all that each member is in the best position to consider the work that they're doing and to use reasonable judgment to determine the definition of practice and if the policy applies to what you're doing. And if doing so, that practice hour counts towards that 500 hours of practice over the 3 years. And of course, if in doubt, we are here. We can help with problem solving. We can help apply the policy and the definition together with you. Great, we're going to go through some scenarios next on the next slide. And this is where we'll apply the definition and the policies. And we'll start off with our first scenario. Would this count as a currency practice hour? So in this case, an employer has asked if a dietitian can perform nasopharyngeal swabs to assist in COVID-19 testing. And this is a question that we got during the pandemic. We know that growing demands for care result in dietitians being able and being asked to provide care in areas that we wouldn't commonly work in. We wouldn't be trained to do nasopharyngeal swabs. So we might be thinking of that in terms of our scope. Of course, individual circumstances are going to vary based on the practice setting and nature of the professional practice, but we'll apply the 3 categories. I do want to just talk about just before we go on to the next slide, if we could just go back for a moment, the role and task framework. So often when we're faced with new tasks in practice, this can I do this or should I do this type of question, we have used the role and task framework during, when dietitians are assuming new roles, new tasks, considering new opportunities, and you have those types of questions. There's 4 questions that guide you through to help you determine if it is, if you should be or can you be doing this type of work. So specifically in this context related to legal and organizational considerations, during the pandemic, we saw that, depending on the type of swab, what kind of swab it was it a controlled act or not, right? And in this case, a nasopharyngeal swab going beyond the nasal passages where they normally narrow. So depending on that, getting advice within your organization, considering other organizational policies and legislation. And then if it is a controlled act that is not within our scope of practice, whether somebody accepts it really depends. So like Carol mentioned, the standard for practicing under a delegation of a controlled act outlines those minimum expectations that we're expected to follow when we're accepting a delegation. So again, something like, do you have the knowledge and skill to take this on? Is there training being provided? What about liability insurance and those kinds of questions that dietitians need to be aware of? And so, applying these all to this situation, Again, if we're to accept a task that's outside of a scope, practicing out of scope, or again, we can consider category 3, the temporary redeployment being defined as employment within the health system to perform activities that are non-traditional for dietitians in support of the public health response to prevent or alleviate the effects of COVID-19. And so, where are there competencies such as communication, collaboration, or management and leadership, or professionalism and ethics, etc. On the next slide, to clarify, how many redeploy? Oh, so we've gone through the categories already. So if we could just flip back for a second, Trina, thanks. We could see, category 2 and 3 in this case would apply to the scenario. So we'll go on to the next slide just to clarify how many redeployment hours can one count. And the policy states that starting at renewal, dietitians who are redeployed will be able to count up to 166 currency hours per year of redeployed work until the pandemic is over. And again, any times that you're practicing dietetics will be counted as usual. So for example, if a dietitian was temporarily redeployed 2020, 2021, they can count up to 166 hours. And if, in 2019, you were working in your usual job, you would count those hours for that time period. I'm going to pause now for just a moment to see if we have any questions or comments, anything so far. Turn it over to Samantha.
I don't see any questions or anything written in the chat so far, but certainly if you have anything that you're wondering about, do put it in the Q&A box. We're happy to answer your questions as well as we can. If not now, then at the end we can come to it, or perhaps as we go along, we may answer it along the way. So on our next slide, we're going to talk about a second scenario. And would this count as a currency practice hour? So the scenario is, I live outside of Canada and provide care to clients outside of Ontario. So we'll go to the next slide just to apply those 3 categories that Diane went through with you. We just thought, let's just look at these categories one more time. So we have the categories of our revised definition of practicing dietetics. Does it fall as a controlled act? Or does it fall under temporary redeployment duties because of COVID-19? So in this case, looking at the definition, providing dietetic care to clients using our reasonable judgment, we can ask ourselves, is this assessment of nutrition related to health status and conditions for individuals and the management and delivery of nutrition therapy to treat disease? And I think we can easily say that this scenario, out of province dietetic care, counts towards practice hours, provided members practice dietetics according to the definition of practicing dietetics, as you've seen. And it probably doesn't look like our category 2 and category 3 seem to apply here. So just a friendly reminder, though, that dietitians, we do advise people, we don't have a prohibition on dietitians practicing outside of Ontario, but that we do advise you to follow any laws or requirements in the jurisdiction that you're practicing in as applicable. So if you are practicing with clients elsewhere outside of Ontario or outside of Canada, follow the laws in that jurisdiction where you're located and or where your client is located. And this might mean that you have to contact the regulatory body where your client is or where you are and just see what they say. We can't speak to the laws in other jurisdictions outside of Ontario. So certainly we do advise you to sort of do that quick check. We also want you to ensure that you hold liability insurance for practice outside of Ontario or outside of Canada to make sure you have coverage, and to ensure that liability insurance coverage that you consider currency exchange if it's not in Canadian dollars, right? That the currency still translates over. Now we have one more scenario next. Actually, we have more than one more, but we'll send the next one over to Carol.
Thank you. So the next one, the next scenario, we're going to talk about, I'm doing a PhD in nutritional sciences. Does this count as a currency hour? So again, we can apply the 3 categories. Does it fall within the updated definition of practicing dietetics? Is it a controlled act according to the standards? or is it considered temporary redeployment duties for COVID? And one of the things is you heard us say is that when we get calls from our members and we say, we cannot tell you whether you're practicing dietetics and you need to use reasonable professional judgment, this is a really great example of a task that can have many different components that you really need to tease out to determine whether you're practicing dietetics. For example, while completing studies can be considered professional development, so on the surface, you can't count doing a PhD as practicing dietetics. However, in applying your professional judgment, you might determine that within your PhD, you're doing some, say, research where you are using your nutrition knowledge to engage in food and nutrition types of research, and therefore you're applying the definition of practicing dietetics. And given that, you can count that component of your PhD program towards your currency hours. Another thing that you might be doing within your PhD program or your research is a controlled act. So you might have a delegation to communicate a diagnosis while doing that research, and therefore that component you can count as currency hours. And if we think of category 3 in terms of redeployment, likely there might not be anything that you're doing in terms of redeployment related to the pandemic. But then again, we're asking you to use your professional judgment. So only you can determine exactly what you're doing so that you can count that towards your currency hours. And again, if you're practicing, even within the PhD, the requirements are that you're using the RD title and you're holding liability insurance as well. So just to reinforce that. And I think that's the end of this particular scenario. So I'm going to hand back over to Samantha for another scenario.
Thanks, Carol. All right, so we'll move on to our next slide. And we're going to look at whether if you're doing some volunteer work while you're on parental leave, whether this would count as a practice hour as well. So we have had a number of calls from dietitians who do this. They're on parental leave. They want to still keep their RD title and keep practicing as they're able. And so again, those 3 categories that we've gone over, we're going to apply again and just look here. So say, again, Carol spoke of using reasonable judgment. And the terrible answer is it depends, isn't it? I mean, no one wants to hear that answer, but really it depends on what type of volunteer work you're doing. Are you practicing according to that definition of practicing dietetics? Are you using your title registered dietitian, and do you hold liability insurance, whether it's private insurance to cover you while you're outside of your employer insurance, say, for example? So let's say during your leave, you want to post on social media and you want to do educational posts on, say, infant nutrition and feeding. Then we could see that these activities would fall under that category 1 of practicing dietetics, and you could count these hours, for example. But to clarify, you need to be using the title and you need to have liability insurance to ensure you're doing that while you're practicing. And we could look at category 2. I mean, if you're posting on social media, it doesn't really fall under a controlled act, doesn't really seem to apply here. And we're not doing any kind of temporary redeployment work related to the pandemic. And so the key here with this scenario is practicing dietetics according to that definition. So again, you're going to look at the type of volunteer work you're doing. Are you working in the school library and volunteering with the school? That would be a really different scenario than if you were, giving a nutrition talk, say, for example, to parents of the school or teachers of the school. So you can kind of see where you need to use your judgment to kind of consider where it would fall under that definition. So let's move on to our next scenario. And we'll pass it back to Diane, I think.
Thanks, Samantha. As you were describing that scenario, I was looking at the definition and, someone calls and asks that question. I'm doing social media, the example that you gave, right, on infant feeding. And so, when I look at the statements and the activities, it's like, are you communicating food and nutrition information in, it says print, radio, television, video, internet, or multimedia format? So asking yourself those questions can help you problem solve through, by applying the definition. So we're going to look at this one now. This is, would this count as a currency hour? I write nutrition policies and I don't have clients or patients. Sometimes we get dietitians calling and asking us, I'm not practicing with clients or patients, and that's okay. That's not a condition for the definition. It includes various practice areas and workplace settings, and it doesn't only include dietitians who work directly with patients or clients. So we're going to apply the 3 categories. If I took the definition here and I asked myself these questions, am I assessing, promoting, protecting, enhancing health and the prevention of nutrition-related diseases in populations? Am I using population health and health promotion approaches, strategies focused on interactions amongst the determinants of health, food security, and overall health? Am I developing or advocating for food and nutrition policy? So if you're answering yes to those questions, again, you could check off category 1 in terms of the definition of practicing, and it would apply. If we think of category 2, controlled acts probably don't apply here, and neither would the temporary redeployment related to the pandemic. So the key here with this scenario is, again, looking at the definition, asking yourself those questions, using your reasonable judgment to determine, knowing the role inside and out as you would know it, right? All right, so we can go on to the next scenario. I think this is me still, right? Yes, okay. So we're going to talk about adjusting insulin for clients under a medical directive. So would this count as a currency practice hour? So again, here, let's look at the 3 categories. One is practicing here. They're assessing nutrition related to health status and conditions for individuals, groups, or populations, managing the delivery of nutrition therapy to treat disease. Here we could see that category 2, the controlled acts would apply. Adjusting insulin would be considered prescribing. We have a position statement and practice guidelines to assist dietitians in this area. And again, delegation for the controlled act of prescribing. So in this case, we see in the example, the delegation is being conferred through a medical directive for a specific group of clients. So if the task or activity falls within the performance of a delegated act, you're still relying on your dietetic competencies as you're performing the controlled act, you're practicing the act as a dietitian, then yes, you could count these. In this case, this doesn't seem like to have any temporary redeployment related to the pandemic. Again, we could see category 1 and category 2 here would apply, practicing dietetics, and then that activity falls within the performance of a delegated controlled act. Although prescribing is outside of our scope of practice, one can be delegated and then accept the delegation and follow the delegation standard and do this, and they're practicing while they're doing it. Great, I'll pass it over to Samantha now.
Thanks, Dan. All right, so we'll move on to our next scenario of I was off on leave and resigned my membership. I came back to practice and my membership was reinstated in June of 2020. When would I declare my practice hours? So this doesn't happen very often, in that we do hear from a lot of members who maintain their membership during leave. But for this member who did resign and return to practice in 2020, their declaration would happen in 2023. So from reinstatement. So the breakdown of practice hours, again, will vary by member. For example, if someone resigns and reinstates their membership, they will be asked to report their currency hours related to their reinstatement date. So in this case, it was June of 2020. So you would report your 500 hours over the 3 years, which would take us to the 2023 renewal. And so for those dietitians who maintain their registration during their leave, your obligations to declare practice hours annually at renewal remain the same as they did prior to going on leave. And sometimes we need a little refresher to make sure we get pretty busy when we're on leave sometimes, depending on your leave. And so it's to understand that if you're maintaining your registration, you still have to do your hours, you still have to declare all of that. Okay, and maybe what we can do on our next slide is just maybe have a quick look at our member dashboard. Now, this is something you guys would be familiar with when you log into your member dashboard off of the main college page, and just review what you'll see when you're declaring your practice hours. So here on screen, this is our screenshot from and this is based on the registration regulation that specifies 500 hours and the required declaration over the previous 3-year period. And before declaring your practice hours, we encourage everyone to review the definition and the policy, which we reviewed already today. And we have the links in there in English and French. And you're asked to confirm that you have reviewed this and taken this into consideration. And then you're asked if you have practiced more than 500 hours in the past 3 years. And there's a yes or no drop-down box that you select your answer. If you've practiced fewer than 500 hours, then you'll get another section where you provide a breakdown of the hours in each of those years. And you'll see here that it'll be from November 1st to October 31st of each of those years. Okay, and once a member self-declares fewer than 500 hours over 3 years at renewal, you get a letter by email from the Quality Assurance Program with options and to help you determine the next steps. So we'll move on to the next slide. This just tells you a little bit about the notification process. The quality assurance staff notifies these members usually by about mid-November of your options. And by mid-January, you'll have to select your option online, and that's through your member dashboard. So maybe on our next slide, what we can do is just really quickly go through what your options are if you do have to declare fewer than 500 hours over 3 years. So we have 3 options. One is completing a learning diary, and this is something that dietitians may choose to submit. It shows activities like continuing education, professional development activities accomplished within the last 3 years. This allows dietitians an opportunity to demonstrate they've maintained their hours that the dietitian has practiced are also taken into consideration above and beyond this. And the diary gets assessed by and evaluated by trained assessors independently of one another. And this is an option typically for dietitians who are practicing, but maybe just aren't meeting that 500-hour requirement in the 3 years. Second option is to sign a voluntary undertaking. We love acronyms in regulations, so we call this the VUT. And signing a voluntary undertaking means the dietitian agrees not to practice dietetics unless they've been assessed and have completed upgrading requirements as directed by the Quality Assurance Committee. Now, this is typically when a dietitian realizes that perhaps they're not practicing dietetics anymore. It could be because of job changes, family leave, or other things like illness or anything like that, and perhaps don't foresee practicing in the near future, but they want to remain registered and they want to maintain their RD title and being a regulated health professional. The last membership, not always the most popular one, but sometimes the final option is if the dietitian is no longer practicing and no longer wishes to be a member anymore, they could resign their membership as well. Also important to note that as members, we have to participate in the quality assurance program. So this includes responding to the college by deadlines in email communications that we get. And in some cases, if members aren't fully participating in a process from the quality assurance program, they could be referred to ICRC, which is Inquiries, Complaints, and Reports Committee. If you sign a voluntary undertaking or a VUT, this means you're exempt from participating in these QA program processes. And we'll move on to our next slide, and I'll pass it back to Carol.
Okay, wonderful. So we're in our last 15 minutes of the session today, and I just want to talk a little bit more about the learning diaries as an option. Next slide, please. So if you think about it, the learning diary really is a record of someone's professional development and their learning. And there's a lot of research that backs up this form of assessment. So learning diaries require reflection over time. It captures the quality and quantity of your work, describing your professional development as a dietitian. And as discussed earlier, we know that professional development can help dietitians maintain their competence and increase their competency levels. We know that competence is more than just the accomplishment of discrete and isolated tasks. Instead, it involves the interaction of and the integration of knowledge, critical thinking, judgment, as we talked about, attitudes, skills, values, your belief. It also includes your ability to generate learning that can be transferred to practice. So if you think that you're below 500 hours, we're looking to see that you're continuing your learning and there are concepts that you can transfer to your practice once you're ready to come back to practice or you're okay to practice. So learning diaries really allow members to individually assess their learning to determine continuing competence. Next slide, please. So on our website, we have a template of a learning diary. And as you can see on the slide, you can include your learning activity. So whether it's you're doing a course, the learning resources that you've used, so the actual documents that you might have reviewed, any learning outcomes, so the concepts and the implications for practice, you need to record that in the learning diary. And then you need to reflect on the ICDEPs and link it to the specific competencies that's related to that learning. And as Samantha mentioned, the assessors, 2 trained assessors, will be looking at what you write in that learning diary and assess to determine whether you've kept up with your learning. And thanks for sharing some links here in terms of the learning diaries. And this is also available in French. And again, if you think you're going to be below 500 hours, we ask you to think about being proactive, maybe start keeping your professional development learning diaries so that you can have that if you need. So next slide, please. We do have trained assessors. They get trained for looking at the concepts and implication for bias training, so that they can, we have the 2 members, the 2 assessors that we can then validate the assessment of the learning diaries. Next slide, please. Sorry, next slide. There was a little bit of an animation there. Okay, so as mentioned, ultimately maintaining at least 500 hours in dietetic practice ensures dietitians can practice dietetics safely, competently, and ethically. So just to summarize, using the policy and the categories as we described today, dietitians would be able to exercise reasonable professional judgment to determine whether their practice, our determination is based on their individual circumstances related to their specific role and their practice settings. And if someone doesn't meet the 500-hour requirement, there are options and a process for members, and also support from our professional practice program along the way. So we're here to support you and answer any questions. For example, if a member cannot complete their learning diary, as you heard, there are other options, such as maybe going straight ahead to a competency assessment or redoing or doing the CDRE, depending on your situation. Overall, the CDO QA program aims to foster and support all dietitians' continuing competence and quality improvement through education and assessment. And we do have a survey of our QA program that just went out. We're analyzing that now, and we hope that we'll be able to share that with you in the next few months. So I'm going to hand over now to Diane to introduce what's new with renewal this year.
Thanks, Carol. So a little different, just like to share information. Thank you for being on the webinar today. As you know, this year, there's a question about submitting your insurance policy details for your employer or private practice. So if you have private insurance coverage, if you're practicing dietetics. So what does this mean is giving information, getting ourselves ready with the information when we're completing our renewal through the dashboard, your insurance company name, your policy number, and the dates of your insurance policy coverage. So the policy start and end dates. As we know, we all have to hold liability insurance if we're practicing dietetics. An individual policy would cover us for work. So for example, any job or volunteer work, if you have your own individual policy, and an employer coverage would cover you only for the specific work that you do for your employer. If you rely on your employer's insurance coverage and you're unable to obtain policy details before annual renewal, you can submit your annual renewal this year without these policy details. The key here is just for all of us not to make assumptions about coverage and to verify that we do have sufficient coverage. It's all part of our professional obligations. And you might be wondering, so why is this required? It's been informed by years of random selection. For many years, some random audits did show that when we looked into the details, when a member looked into the details in terms of coverage or adequate coverage based on the bylaw requirement. So just like when we renew our license plates, we are asked to provide the company, the policy number, etc. Helps us to ensure that we have the necessary coverage. And as a result of this data and for public protection, we're going to be submitting evidence to demonstrate that we hold this liability insurance as noted here on the slide. And the registration program will evaluate this process. And as always, we appreciate your feedback as we move forward. Go on to the next slide. At this point, we'll turn it over if you have any questions specifically about the policy, the definitions. We always share our contact information and an evaluation. We'd love to hear what went well for the webinar today. What can we do to improve? So we'll turn it over to you now. We have about 5 minutes for questions. If there are any questions from the group, and I'll turn it over to Samantha, the moderator, the question and answer box.
I'm just keeping an eye on the box and on the chat. I don't see a lot of stuff coming in, but I'll just give people just another little bit. If you have, I see
You have a raised hand.
someone has their hand up.
Yep.
And Benaz, would you like to ask your question?
Yes, hello everyone. Thank you for your presentation. My question is specifically about the last part of today's session about having coverage. It's something that I think I have given feedback in previous years, although I've never worked anything outside my day-to-day practice. I always purchased the coverage for myself, but when we renew, there is never a room or space to allow us to say that we have both coverage through employer and also private. So I'm just hoping that if it's something that can be implemented, so you can see that some members might have like both kind of coverage.
Okay. Thanks for sharing that feedback. So what I hear you saying, Benaz, is just an opportunity to indicate if you have employer coverage and then also your own private coverage for outside of other work that you might be doing outside of your employment.
That's correct.
Okay. Yeah. Thanks. We'll carry that forward to the registration program. I think one of the reasons for that might be if someone does have their private coverage, it would cover them for the work and then also anything outside of work, but it's a good point, and we'll definitely bring that forward. Thanks for sharing that. Any other questions, comments?
I don't see any from my end. Do you guys, maybe if I'm, make sure I'm not missing any?
I think I just dealt with a question the other day, right, about the learning diary, like what's more important, quality or quantity of professional development. Carol, maybe if you want to try that one.
Yeah.
Sometimes it's like how much detail in your learning diary, or
so we're looking for the quality. We're looking to see the concepts from the learning and the implications for practice. So what did you, by going through the specific learning activities, what were some of the learning concepts that you can then apply, or the implications for practice, and then to relate it back to the competencies. So those are the key things that you're looking for when assessing a learning diary. So I would say quality over quantity.
And I think, you know, a reminder that it is 2 independent assessors that are assessing, and they're looking at practice hours and professional development. So for example, someone may have certain number of practice hours and PD, someone may have less practice hours, more PD. It really depends on each individual, right? And it gets
Yeah,
independently assessed by 2
it
assessors.
depends on the category, because there's some people who that might be under 500 hours because they're not practicing at all,
Right.
as well as there might be some people who are under 500 hours because they're not able to meet the 500-hour practice. So they're practicing less than.
I think we have a question now in the,
Oh, excellent.
Yes.
So can you explain more about what the last column of the learning diary is? Yes, the last column of the learning diary is actually for you to go through the ICDEPs, the learning, the competencies, and try and connect your learning concepts to the actual competencies. So in that way, it is competency-based self-assessment.
yeah, so the learning that you may have, let's use an example, enteral nutrition. If you did some professional development related to that, linking it to the competency that would
Right.
speak to that outcome or that learning outcome.
And on the website, we actually have an example of how to link it back. So for example, there's one example on the website that says clinical reviews. The person went through PubMed articles. They listed the concepts and the implications for practice. And then they also linked it back to the competencies. For example, what the concepts that they learned directly applied to, say, item 1.04, which is apply understanding of dietary requirements and guidelines. An example of 1.05, apply understanding of dietary practices. So you're going to sort of link back the learning to the competencies.
Yeah.
And the competencies are the entry-level requirements for all dietitians. And many dietitians who are currently practicing may not be familiar with the ICDEPs. They're brand new. This is version 3, I should say, a new version.
2020.
Yeah, 2020 version. So even if it doesn't apply in terms of a learning diary, it might be helpful just to review competencies generally. Okay.
Good.
Well,
It's
thank
2
you so
o'clock.
much. Yeah, on the dot.
Yeah, if you
Great-
have any
great
other
question.
questions, you can reach out. Our contact information is on the screen and on the website, and we look forward to your questions. Please don't hesitate to contact us. Again, we can help with problem solving, and we appreciate you being here today. And want to thank everyone and have a great afternoon, and take care.
Thanks, everyone.
Bye. Take care. Bye-bye. Thank you.